So, sounds like everybody kind of knows what HIRTA is. For anybody that doesn't know, HIRTA, these are what our newer buses look like. They have the slogan, "For anyone, for any reason." That's really just to showcase that anybody can use HIRTA. So many people think it's just older adults, people with disabilities, but really anybody can use HIRTA. We provide door-to-door transportation, which means we pick you up right at your door and take you right to the door you need to go to. We serve Boone, Dallas, Jasper, Madison, Marion, Story, and Warren counties. And then in Dallas County, we have what's our Health Connector project. And that's what we're talking about today. So the Health Connector project is a USDOT project, supported by a bunch of different acronyms. FHWA, OSD, FTA, all the letters. I don't even know them all. It's working in transit is like literally just learning acronyms. It's crazy. So yeah, that's a little bit about the trip. So basically what the vision of this project was is a complete trip from beginning to end for your medical trips and your transportation all in one. It's kind of a one-stop shop. So in the Dallas County Hospital there in Perry, we have this kiosk. This kiosk allows people to just input their details. I'll show you how the kiosk works in just a little bit. But it's really, people who don't have smartphones, people who are just at the hospital and want to get a ride home. They would simply come up here, put in their information, and get a real-time ride back to wherever they need to go to. So this is the interface of what it looks like. You put in your address. The origin's always going to be the Dallas County Hospital, since that's where the kiosk is. You'll be able to put in you need guests, if you need a wheelchair, and then you just put in your information, and then we'll go ahead and watch this. Just a bit of a.
To book a ride, first be sure you're registered as a Health Connector rider. Then select book a trip. Enter your name, phone number, and email. Make sure this matches what's on your HIRTA account. Select your destination. The origin will always be the hospital. Enter any notes, add guests, or personal care attendant. Click Next and your ride will be automatically scheduled. To check a previously booked trip, simply input the same details you entered to book your trip. Click Next, and you will see your estimated pickup time. It's that simple. Now, get ready for your ride.
So super simple to book. It's easy. It works with the kiosk, and then it's just it allows us to easily book a ride in our system to place a vehicle with that person. So another aspect is NaviLens throughout the hospital. I'll pull my phone up in a little bit when we have a code on the screen. But NaviLens is a wayfinding app that's used to kind of get your way around the hospital. There's different signs throughout the hospital, but this is what the NaviLens app looks like. There's NaviLens and NaviLens Go, which I'll talk about the differences in just a second. But this is what the app looks like. They're super scannable up to 60 feet away. Various different angles, so yeah, readable from up to an 80-degree angle. Super simple, super fast. And so NaviLens versus NaviLens Go. NaviLens is designed for people who are blind or have low or no vision, whereas NaviLens Go is designed for sighted users. NaviLens provides like auditory readouts as opposed to NaviLens Go, which is more on the screen. So here's what the code looks like. So there on the right is the code, and then on the left is actually one of our HIRTA rider from Story County, and her service dog Wishes. This is Jamie. She's completely blind and uses HIRTA services to get around. I had her download the NaviLens app, kind of walk around the hospital, and she was able to find exactly where she needed to go. So let me pull up NaviLens real quick. So if I pointed this,
22 inches away, reception, right, ahead.
so then there's, like, it shows exactly where the reception is. And if I click locate,
Activating 360 vision 23 inches away. Arrived at reception.
so it's a little different because it's blown up. And the way it works is, it shows, we're not allowed to like resize these at all because this, if it's this big, it makes it seem like I'm right in front of it. But anyway, so if you click locate, it'll literally say, 30 feet ahead, reception, and then if you start going right, it'll say, turn left. So it's super easy to use. She was able to use it flawlessly, said it was a really great help. And one of the things she kept asking is like, when can we get this to Story County? So that's going to be one thing. We're working on getting the health connector to Story County right now. And then additionally, these are on our vehicles as well, the same kind of codes. There's two different kinds of codes. There's free codes, which are static. We can't customize anything, so reception, waiting room. So the Dallas County Hospital utilizes the free codes. They're, like I said, just basic. They still work and everything, but we can't customize anything. HIRTA uses the paid codes that we have on our buses, so this is a paid code, and then we can make it say whatever we want. So this one says, like, this is a HIRTA bus 2237, as opposed to just basic information like reception. And then there's kind of what it looks like for the bathroom signs there at the hospital. Like I said, she was standing at the front door of the hospital and was able to easily reach the women's bathroom. She clicked locate, and then she was able to navigate through the hospital.
So, Danny, are those always suspended from the ceiling?
They don't have to be. This is just where the hospital decided to put these ones. I know the reception one is just mounted on the reception desk, and then the entrance and exits on the doors. Another part of this is the infotainment system. This is available on the Health Connector bus. So it's basically just a live feed of a TV, and then we build presentations so we can push remotely to it, and then we can change it to however we like. So right now, like, we currently have a Dallas County Hospital presentation, some messages from the health department about the Health Connector, and then this can be easily changed however we see fit, whenever we see fit. We just publish remotely, from my office. Another cool thing about this is it has GPS, so once we get within 1 mile of the health department or the hospital, we can make it trigger like certain slides. Same with like businesses. If like a business wants to advertise with us, we can say like, once we get within 1 mile of Hy-Vee, it can run some specials on our screen. So this is the registration page and what it looks like. First step into getting on Health Connector is registering for Health Connector. So the navigators, the hospital staff have been trained to kind of do these registration forms with people. Just ask basic information, first, last name, email, if you have any, phone number. Do you live in Dallas County? That does not disqualify you from writing Health Connector if you don't live in Dallas County. It's purely, this project is piloting in Dallas County. So if the answer is no, you can still write. We just wouldn't be able to count the trips for this project. And then, of course, optional information at the end, asking about languages, and then please indicate if you identify any of the following. Those are our identified vulnerable population lists that we identified through the project. So this is just a way to help track our numbers. How many older adults are writing, how many people with disabilities are writing, people with low income, etc. Another aspect is the EHR dashboard that we have. This communicates with HIRTA writers as well as the hospital's EHR. So all this information is, there's no sensitive information in here like anything that would violate HIPAA or anything. But this communicates so that people can see your ride or your appointment, and if you have a trip scheduled. So you see the status over there, booked, that means that they have transportation booked, as opposed to, you know, if you can see someone has an appointment, and the status might say like, I can't remember what it says, but, not booked or something like that, that means they don't have transportation. And then we'll get to that in a bit, but we have access to this. Dallas County Hospital, the navigators have access to this, and can easily go in and either schedule appointments themselves or get a hold of HIRTA, and you can schedule it for them as well. So scheduling through the app it functions very similarly to like an Uber. You get logged in, you choose your depart out or arrive by time, and then you select your ride. Hopefully you get a couple different options for pickup windows. We do have a 20-minute pickup window, so if you want to ride at 10, might pick you up at 9:50, might pick you up at 10:10. And then the web portal allows us to expand our language options, so more folks can use if they click through the web portal. Our app is available in English, Spanish, Mandarin, and Arabic. In the web portal through Google Translates over 130 languages. It's the same thing as the app, it just you put your information in where you want to go. So this is, I'm going to show you a little bit about how to book a ride. This is kind of what we talked with the navigators and the hospital staff on how to book a ride for folks. They have a very limited view of our ride booking platform. That's what I'm going to show you here. So you search for a rider using their name, their phone number, their email. And you'll pull up their information. You can see future rides, you can see the rider history, you can see their payment method, all that stuff. It's not going to show you like their card number or anything like that, but any again, personal information other than address. And then you would kind of do this on the back end. You would, put your time in if you want it now or if you want to ride later. You would put your pickup location, you would pick up your drop-off location, you would pick your date and your time, and then you would choose your funding source. So access to care might be your funding source. If you click bill now, that's, rider will pay. So rider pays at the time of pickup is bill now, and just various other funding sources as well. And then once you click book a ride, whoever's booking the ride will get multiple different 20-minute pickup windows. They also might get a no availability, so that means they would have to pick a different time or different date. Or they're waitlisted for recurring trips. So if someone has like dialysis, every Monday, Wednesday, Friday, at a certain time, they're going to get waitlisted for a trip or two, just initially, and then we'll let you know within 24 hours if once that ride gets booked or anything. But ideally, you get the 20-minute pickup window. You select the best option. So this person wanted to depart at 11:30. So the options there were 11:15 to 11:35 or 11:20 to 11:40. So if you'd rather be earlier or if you'd rather be later, you can kind of work on that, which ones you prefer. So that's about it. I know a lot of stuff I threw at you. Abigail has these slides, so she could definitely send them out if you'd like. Otherwise, we have lots of different information here. There's the Transit Health Connector is the hub for this project. There's our website as well. And then the link tree on the QR codes, or on the signs, or the NaviLens signs, there's a QR code at the bottom. We also use the link tree for various other options, and just various different marketing and everything. So that QR code links to this link tree over here on the right, where you'll see about the Health Connector FAQs, the Health Navigation Referral Tool, how to book on Dallas County Hospital, how to book through Mercy One, and then links to download the NaviLens app as well. And that's it.